Ang buong mundo ay nakaranas ng matinding krisis dahil sa patuloy na pagtaas ng bilang ng mga nagpositibo sa coronavirus disease of 2019 o COVID-19. The COVID-19 pandemic has led to a large event cancellations, travel restrictions, social distancing, work suspension, and other unprecedented measures. So how did we get to this point? In this video, we will discuss the history of COVID-19, the unfounded issues behind in this outbreak, the current world and Philippine situation, and ways to prevent in this infectious disease. So first, what is coronavirus? Coronaviruses are a family of RNA or ribonucleic acid viruses. The name is from the Latin word corona, meaning crown, which describes the appearance of the projections seen under electron microscopy that resemble a solar corona, and it was surrounded by a lipid envelope with protein spikes. Coronavirus infections are common in animals and humans. Some strains of coronavirus are zoonotic, meaning they can be transmitted between animals and humans. Coronaviruses consist of 4 genetic materials. The alpha and beta originated from bats and rodents, and gamma and delta originated from avian species. Coronaviruses are responsible for a wide range of diseases in many animals. Noong 2002, ang SARS-CoV o Severe Acute Respiratory Syndrome Coronavirus Disease ay unang na-identified sa Guangdong Province, China. According to the World Health Organization, ang animal virus na ito ay galing sa mga paniki na kumalat sa iba pang mga hayop tulad ng seabirds and then nag-mutate sa mga humans. Noong 2012 naman unang na-identify sa Saudi Arabia ang MERS-CoV o Middle East Respiratory Syndrome Coronavirus Disease. Yung reservoir host nito is galing sa dromedary camels. Ibig sabihin ang dromedary camels ay ang animal source ng infection sa humans. In December 2019, human cases of pneumonia of unknown origin were reported in Wuhan City, Hubei Province of China. A wet market in Wuhan, China is catching the blame as the starting point of the coronavirus outbreak. Patients who came down with disease at the end of December all had connections in the Huanan seafood market, the complex of stalls selling live fish, meat, and wild animals. The researchers believe that the new strain virus probably mutated from a coronavirus common in animals and jumped over to humans. The new COVID-19 or coronavirus disease of 2019 is caused by the SARS-CoV-2 or Severe Acute Respiratory Syndrome coronavirus 2. The most likely ecological reservoir for SARS-CoV-2 are bats. And the World Health Organization believes that the SARS-CoV-2 are not directly from bats to humans, but one or more animals at the market in Wuhan were infected by bat and serve as an intermediate host for the transmission of the virus from bats to humans. The common signs of COVID-19 infections are difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, fatigue, sore throat, and more severe cases infection can cause pneumonia, kidney failure, and death. The World Health Organization is a specialized agency of the United Nations responsible for international public health. Pandemic is a widespread infectious disease that sickens a large number of people worldwide. When a disease is isolated in one country, it is called an epidemic. Lockdown. Everyone is mandated to stay at home. The government will provide all the basic needs. Relief goods will be brought to every house, or one household member is allowed to go out to buy food and necessities in the neighborhood establishment.
Hi everyone! For today, let's talk about the effect of COVID-19 to the Philippine labor force. So let's start. When Mr. President Duterte declared the entire Luzon under enhanced community quarantine, The ECQ ordered the cessation of all operations of private establishments except those who rendering basic and essential services, and other establishments expressly are exempted as a preventive measure to the further spread of the said virus. As a result, many workers lost their source of income temporarily or even permanently, and otherwise suffered a reduced source of income. Thousands of workers may lose their job in the next 6 months as businesses take a hit from novel coronavirus disease outbreak. The Depend Job Philippine spokesperson said that Mr. President and Labor Secretary Silvestre Beloditor must impose no retrenchment policy amid to COVID-19. The state and corporation must provide emergency financial support for contractuals under no work no pay policies, and the both public and private sectors, as well as financial aid for poor Filipino families who are the most vulnerable sector over the COVID-19 outbreak. According to the Trade Union Congress of the Philippines, they see 7,000 more retrenchment and layoffs amid to the growing coronavirus outbreak crisis. It made the forecast after the Philippine Airlines terminated 300 employees, citing losses incurred because of the canceled flights due to COVID-19 travel bans. TUCP discussion with union leaders and other industries said that full retrenchment is just the beginning of the bigger adverse of the economic impact escalating the outbreak of COVID-19 phenomenon. The TUCP representative, Mr. Raymond Mendoza, said that based on their assessment, other industries will follow suit and lay off non-essential workers. So in consideration with the outbreak's continued impact to the both employers and employees, all are requesting to cooperate and lend a hand. Private establishments are highly encouraging to provide or implement flexible work arrangement instead of ceasing operation and permanently laying off of employees. In the process, private establishment employers are encouraging to avail COVID-19 adjustment measure program for the benefits of their employees. So as we can see, COVID-19 pandemic disease outbreak has become a big impact to the Philippine labor force and seriously affect the economy of our country. As a student, in what way I can help? So I can help by following the local guidelines of the government by simply doing those preventive measures, staying at home, keeping myself healthy, be informative, spread positivity, and lastly, the most powerful is to pray for everyone's safety, especially for our frontliners and the government. In spite of this crisis, let us help each other to combat our enemy, and let us not be against to the government, but to the virus instead. We people who are staying at home, let us be the backliner who will support and pray for our country to become better and to overcome this pandemic disease.
Myths or unfounding issues on COVID-19. In a February report about the spread of the novel coronavirus, the causes COVID-19, World Health Organization officially used the term infodemic to describe the avalanche of information circulating about the virus. They were concerned that it was becoming hard for people to find trustworthy sources and reliable guidance. The sheer volume of information and misinformation had become overwhelmed. As the new coronavirus spread, as well-informed public will be essential to prevent not only infection but unnecessary panic. Communicators must find ways to engage with the online chapter in the way that it both pragmatic and respectful of the woman condition. If people are anxious and during an epidemic they usually are, let's examine those anxieties. Let's understand them and then let us the insight in the fight against misinformation. A current world situation. Kasalukuyang sitwasyon sa buong mundo tungkol sa kumakalat na coronavirus disease. New cases nitong April 11, 2020. Buong mundo may 1,610,909 confirmed cases. 99,690 deaths. Sa Europe, 839,257 confirmed cases. 70,565 deaths. Region of the Americas, 536,664 confirmed cases. 19,294 deaths. Western Pacific region, 118,509 confirmed cases. 4,017 deaths. Eastern Mediterranean region, 92,226 confirmed cases. 4,771 deaths. Southeast Asia, 14,161 confirmed cases and 617 deaths. African region, 9,340 confirmed cases and 415 deaths. Infection in healthcare workers. Healthcare workers play an essential role of the front lines providing care of patients in context of COVID-19 and during routine health services. They provide critical care to patients and ensure that infection prevention and control. Measures are implemented and adhered to in healthcare facilities in order to limit healthcare-associated infection. As of April 8, 2020, 22,073 cases of COVID-19 among HCWs from 52 countries had been reported to WHO. However, at the present time, there is a systematic reporting of HCW COVID-19 infection to WHO, and therefore their number probably underrepresent the true number of COVID-19 HCW infection globally.
So, araw-araw nadadagdagan ang bilang ng kaso ng COVID-19. So, ano na magiging sitwasyon ng Pilipinas ngayon? Ang daming taong naghihirap, ang daming taong hindi alam kung saan kukuha ng pangangailangan sa araw-araw. Dahil ngayon, in-extend na naman ni Pangulong Duterte ang ECQ, so mas lalo tayong maghihirap dahil hindi natin alam kung saan tayo kukuha ng pangangailangan sa araw-araw. Lalo na ngayon, walang transportasyon, doon lang din kumukuha ang ibang tao ng pera para sa mga gastusin. So, iwasan na po nating lumabas ng bahay, maging positive lang tayo sa lahat, at manalangin. Isipin natin na panaginip lang ang lahat ng ito. Trust God. At gigising tayo na wala na itong virus na ito. So, panatilihin din nating malinis ang ating tahanan. Kaya nga may ways tayong sinusunod. Ways to prevent or minimize the outbreak. So, panatilihin nating malinis ang ating mga kamay. Ugaliin natin itong hugasan. Gumamit tayo ng sanitizer. At iwasan nating hawakan ang ating mata, ilong, bibig, pag marumi ang ating mga kamay. At sundin natin yung ipinatupad na social distancing. So, 1 to 2 meters ang layo. At pagbabahing tayo, kailangan nating gumamit ng tissue or face mask para hindi mahawa ang ating pamilya. So, ang payo ko lang, huwag nang matigas ang ulo natin. Stay at home and be positive always. Malalampasan din natin to mga kapatid. Maraming salamat!